This is the CST team. Oops. So this is the CST team we have. We have the leads, we have the informatics specialist, we have business analysts on this team. We have the ambulatory scheduling, registration, provider, order sets, and lab team members, and medication management and clinical trial team members on the SWAT team for renal. This is a quick agenda, so we would go over introductions. I'm just going to give a refresher of the items that we discussed from the previous sessions, because it has been some while since we had the last session. I'm just going to quickly demo the power plans for the providers. I'm going to also demo message center and other ambulatory organizer. What the main portion that is not included in the agenda is BPMH and MEDREC. So that would be the main demo for this session. But other than that, I'm going to demo some allied health workflows, and we do have some additional forms that we want to review with the SMEs. Okay. The purpose of this session is to validate what works and identify any gaps, validate what content works as is and identify any gaps or changes required, and validate the standards and processes that would configure to the new Cerner system. Our guiding principle, we support the 3 HOs with establishment of common clinical and process standards and workflows, order sets, clinical guidelines, plans of care, and electronic health records. Must-haves, CST does focus on these 4 principles of safety, regulatory, financial, and content changes into the system. A quick review of the applications that I'm going to be talking about. So PowerChart is an application for clinical documentation. The scheduling chatbook is the scheduling application. PM Office is for registration. WorkQ Monitor is for scanning documents into the patient chart. PowerPlan is order set. PowerForm is the electronic form. iView is the electronic flow sheet. Dynamic documentation is the clinical notes. Ambulatory organizer is the summary of scheduled appointments, and message center is the internal messaging application within PowerChart. Sorry, just a second, my computer froze. Sorry, I'm gonna reshare again. Okay, so this is a refresher of what we discussed in the last session. So the clinic flag for kidney care clinic would look like VGH renal pre-dialysis in the system. I'm going to quickly dive into the system and demo the message center, power plans, and follow-up orders. We do need to figure out if the VGH SMEs would like to use this follow-up order though. Okay, I'm gonna quickly dive into the system. I'm logged in as a provider in here, and when a provider logs in, this would be the landing page for the providers. So as mentioned earlier, we do have an application called Message Center into the system. So just consider Message Center as an outlook for communicating between the clinicians. So the various components of the Message Center is you can send general messages to one another. And this is how the general messages look like. So if you receive a general message, it's going to say similar to what it looks in Outlook. So you're going to double click. And once you double click, the message would open. And once the message is open, you can either reply to it, reply all, or you can delete it, very similar to how it looks like in Outlook. Other than messages, you can also receive documents. You can receive orders for co-signature. So for example, if a provider is not in the unit and the nurses or any clinicians wants to place orders, they can always request a co-sign from the providers. So whichever orders are requested for co-signature, they're going to appear under this tab. And if there are any results being forwarded to the clinicians, it's going to appear in this tab. Okay. We do have pools that we decided also in the previous session. So we're going with the provider pool, in which there'll be the providers in which they can, rather than communicating or sending messages or results to one provider, they can send those messages and documents to that provider pool, and all the providers that have opted into that provider pool will receive messages.
Hey, Puneet, can I just stop you there? I think Dr. Zolnardo just has a question.
Yep.
You raised your hand. Yeah, go ahead.
Thanks. Yeah, Puneet, you're just alluding to it now. It's just about this opting into the provider groups. So that means that, just to be clear, so that we can set up a group for each team, in other words, right? We won't.
Yes.
Okay. Yeah.
Yeah. So it's just
is there
like
also an option that you could send a message to the entire, like anyone that's in this big pool?
Yes. So in this pool, if you send a message to the pool, which does mean the group of providers, everybody's going to receive that message who has opted into that pool, or you can send messages to the individual providers as well. There would be clinical pools as well, in which all clinicians can opt in. And then if you send a message or forward a message to that clinician pool, it's going to forward that message to all the clinicians in the unit. Did that clarify, Doctor?
Yes, that's great. Thanks.
Okay. Thank you. So this is how the message center works. There is a functionality for proxies as well. And this functionality is when, for example, a clinician is on vacation or is not working for some reason, they can always proxy their list of patients to the other clinicians for them to follow. So for example, if a provider is on vacation for 2 weeks, they can always make a list of patients that they're following, and they can proxy another provider on their behalf to follow those patients. Okay. I'm going to quickly log into a patient now. So when I'm logged in as a provider, this would be the landing page for the providers when they open the patient chart. So you see we have the banner bar in the top. It will pull up information from registration. We have the name of the patient. We see process, disease, and isolation alerts if they have been documented during registration. You can see the location where the patient is in. It would say VGH kidney care, but it's just for the purpose of this demo, I'm using the SPH kidney care location. And then you can also see the encounter type for which the patient is coming in from. So for the provider's view, there are different M pages. There's an dialysis management M page for very specifically customized for nephrologists. So there are different components for this under this dialysis management M page. And you can see prescriptions. There's a section for team communication. So for example, if you want to communicate to so this team communication section is available for all clinicians that would be using dialysis management. So for example, if you want to communicate internally with the team, you can add in a message here and everybody who's opening the patient's chart would see the message. For example, I'll say dressing change. And if you say available to all and save, this dressing change action would be visible to all the clinicians who are opening this patient's chart. Okay. There are also different sections for vitals, intravitals, post-vitals, their histories, allergies, their current medications list. There's also a clinical note for the providers. So there are different type of notes that have been built into Cerner for the providers, and there are auto texts that have also built in. So for example, if you select the free text clinical note, it's going to give you a free text to add in information or add in a clinical note that you want. But for the KCC providers, we do have a KCC clinical note. Sorry. It says renal KCC note, and this is an auto text created particularly for the KCC providers. So if you say comma, and renal KCC, it's going to pull in all the information that has been documented for the patient so that you don't have to go in every time and add all this information over and over again. Okay. There's also an outpatient quick orders page. So this is an M page that is customized for power plans. So if you navigate towards the outpatient quick orders page, you will see a section for chronic kidney disease in here, and which has you can see sections for chronic kidney disease, hemodialysis, PD, and it would have all those power plants that are used within the unit. So for example, if we go into chronic kidney disease, it would have all the power plants that the providers would be using and placing for the patients. So for the purpose of this demo, I'm gonna try to place the renal biopsy power plan. You can see it has the list of all the power plans that the providers can choose from. Okay, so I select a renal biopsy, and then when I select renal biopsy, you can see this shopping cart icon on the top right corner of your page. So if you select this, it's you say modify details. You can sign this power plan as well, but the recommended workflow is to look into the details of the power plan first. So if you say modify details, it's going to give you the comprehensive view of this power plan. So this renal biopsy multi-phase power plan has different sections to it: pre-procedure, post-procedure, and the scheduling piece. So as you can see, there are some orders that are pre-selected or selected by default. So, but if you do not wish to order these orders for the patient, you can always go in and uncheck, and it's going to remove the order from the power plan. Okay. Same thing for pre-procedure. There are some orders that have been pre-selected. There are some laboratory orders that are pre-selected, but you can always go in and uncheck, and you can check the ones that you need. This blue X sign means that you need additional information. You need to add additional information into this order. So what you would do is you can right click and modify, and it will open the window for that for the additional details that you want to put in for this power plan. Okay. I'm gonna uncheck this. This renal biopsy power plan also has a scheduling order. So it says SPH renal short stay at the moment, but for VGH, it's gonna say their location where the renal biopsy is performed. So this is how you order the renal biopsy. So I'm gonna cancel out for now. There can be some power plans that are not under this section. So if you see that you want to order a power plan that is not in here, you can always go in and ad hoc it from the orders catalog. So for example, you want to order a transplant testing.
Sorry, Penny, Dr. Zolnerdo just has a question.
Okay.
I could wait until you're done this segment, Puneet, if you like. It's actually about renal biopsy though, so might be a good time to do it now.
Okay, yep.
Okay, so at VGH, our process is I actually haven't checked what they do at St. Paul's, but at VGH, the office secretaries are the ones that currently are booking these with VGH. So if we fill out this power plan in Cerner,
Mm-hmm.
I guess I'm just not clear what happens.
So if you fill out this power plan, your MOAs, so the workflow that we were proposing is the MOAs would communicate with the clerks of the peri-op unit, and then they'll book the patient for renal biopsy. And once they book the patient and inform the patient when their appointment is scheduled, they can confirm this with the MOAs.
Okay. Oh, I see Monica's on. What do you guys do, Monica?
Yeah, so it's a great question. So can you hear me okay?
Yeah.
Okay, so let's say you have a renal biopsy that you're ordering on an office patient that's not even a KCC.
Yeah.
So the process is, so all of the Diamond office staff will be given Cerner access to be able to do registration of the patient. And so they will call your short stay. They'll do all of that just like they did before. They will register the patient enough so you can place the biopsy, this biopsy power plan for the patient.
Okay.
So everything will happen exactly as it did before. However, there will be the difference is that you'll have to ensure they can create an encounter in Cerner so you can place this biopsy power plan, which will be the same for cyclophosphamide or you know, anything that you do. Yeah, so it won't change your workflow. However, does that?
Yeah, that's good. Yeah, I know we talked about it before, but it's just been a while. So, okay, yeah, I appreciate that. Thank you.
Okay. Sorry, just say done in here. So if in case you don't find a power plan in your section under the quick orders end page, you can always go in select this plus icon and select a power plan from this orders catalog and place it. So let's say the transplant power plan was not in that chronic kidney disease section. So I'm gonna place so I'm just gonna so let's say I didn't see that this power plan into that section of under the quick orders end page. So I've went in, I've selected the add button. I'm going to search the power plan that I'm looking to place, and I'm going to place the power plan from here. So it's going to do the same thing. It's going to show the power plan. This power plan does have, looks like everything is pre-selected. Nope, there is some sections that are not selected. You can always go and check and uncheck, and then place the power plan. You can say initiate now if you have to place the plan immediately, or if you want to place the plan for a later stage, you can say plan for later. Okay. That was the little demo that I had for the providers, but I do have a BPMH and MEDREC demo to show. I just wanted to ask the providers, would they want to stay for that demo? That demo was requested by the pharmacists.
I'm happy to stay.
Okay, thank you. I'll stop sharing this.
And just checking, you're going to show the outpatient BPMH and MEDREC, is that right?
Yes.
Yeah, the clinic one. Okay.
Oops. Can everybody see my screen again?
No, not yet.
Not yet.
Okay. So for the purpose of BPMH and Pharmanet, there was some system glitch that we could not show a BPMH in the system. For some reason, the Pharmanet profile was not pulling into the build domain. So what we have done is we did have some screenshots to demo the BPMH and Pharmanet, but I would demo a MedReg into the system. Okay. So for the providers and the pharmacist, under the order section, you have this icon which says document medication by history. So if you wish to do BPMH, you can go under this section and select this button. And once you select this button, this window opens. This is the document medication by history window. So medications that were documented in a previous admission will display here. If this is the first admission, or if this is the first time you're doing BPMH, it would come as a black screen. Is a blank screen. Okay. So there's this button on the top which says external reaction history. If you click the drop down, it's going to give you two options to view and import. So to import the Pharmanet profile, you will click the import button. So once you click the import button, the demographics window would appear. So once you confirm the patient's demographic, you can hit continue. And then it's going to ask you for the patient's protected key password. If the patient does not have a password set up in their Pharmanet profile, this window is not going to appear. But if they do have their password set up, this window is going to appear for you guys to put in the password for the patient. Okay. Once you put in the password, it's going to give you this window to review the Pharmanet patient's profile. It's going to list down the adverse reactions and conditions the patient might have. Okay. So once you hit next, it's going to give you two windows. So on the left-hand side is the Pharmanet profile, and on the right-hand side, it's gonna give you the previously documented external prescription history for the patient. Okay, so the left side is Pharmanet, the right side is your previous documented BPMH. So now if you wish to perform BPMH, you have these two icons in here. So once you select this icon, it's gonna move the particular medication to the right side. It is recommended. So if you see this black arrow in here, if you select this triangle, it's gonna expand the medications, and it's gonna expand the medications and different refills that were documented for this medication. So once you
Penny, sorry, it's Marissa. Do you mind just changing it back to the slideshow?
Okay.
I think it's just a little bit easier with a lot of the screenshots, just for everyone to see a little bit clearer. Thank you.
Yep. Is it better now?
Yeah, thanks.
Okay. So once you click this black icon, it's going to give in the various prescriptions that were filled for this medication. And so for example, you can see there are separate fills on different dates for the same medication. So we do recommend, if you have to see this black triangle, please click on this. Okay. So once you select a medication that you want to import to the right side, it's going to change that white scroll button to orange, and it's going to give you a window for order sentences. So if the window would have different order sentences for you to choose from, but if you see that the order sentence you want to order, you want to place is not existing in here, you can always say none, and then you can fill up the prescription by yourselves. All these fields are not mandatory, but if you wish to fill them, you can. But just to keep the BPMH tidy, we do recommend just filling out dose or route of administration and frequency. But you can fill out the other prescriptions if you have the full details. There's also a section for compliance. This indicate the status. You can indicate the status using the drop-down menu. So for example, the patient is taking medication as prescribed, so it will give you a status of taking as prescribed, and you can choose that status from the status drop-down window. If you see that there are some medications that are not present in the PharmaNet profile, you would see an add button next to the external prescription history. You can always select that add button and you can manually go in and add a medication. So once you have imported all the medications from the left side to the right, there's a button on the bottom right corner which says document history. So after you have completed all the BPMH, you can select this button and then your BPMH would be up to date. Okay. So as mentioned earlier, there were two options which had view and import in that document prescription history. So if you choose to just view the PharmaNet profile and you do not wish to do the BPMH at the moment, you can select the view button and it's going to give you the PharmaNet profile for that patient. Any questions for BPMH?
That's Hillary, the pharmacist. Just wondering about that external med history that you're talking about that's on the right side. Is that referring to like all the patient's previous admissions, or what would we normally see if it weren't blank?
I'll just go back. So you're talking about this button, Hillary?
Yeah.
Do we have anybody from pharmacy on the line?
Yeah, Judith, Judith, hey, Larry. So basically anything that has been that has been entered by any provider using Cerner would be there. So for example, if you did a really good medication history and then the patient got admitted to ER and things have been changed. So basically the latest update will be what you will see. You may not, like on this window, you may not necessarily, unless you expand it, you won't see what has been completed or discontinued and stuff like that.
Oh.
Another thing I want to mention, so when it's talking about importing medication from PharmaNet directly into the BPMH, one of the problem with that is that a lot of the time, the way that it's imported is 1 tablet per day. But sometimes if you look at the note coming out from the medication history about that, it's going to be written lisinopril 1 tablet per day. So you don't actually know the dose that the patient is taking if you do that. So we actually don't import it like that. We actually manually entered all the medication to avoid that.
And that one's an important little thing, because I think we put in almost 500 sets of medications before we realized that. And so if you want your dose of your medicine to show up in your outpatient note, which I'm sure most providers do, then the best way, at least at the start, is to enter in the actual dose entered in instead of importing it. The importing works quite well in the inpatient setting.
So Judith, do you use the document medication by history?
Yes, actually I use it to do, so first of all, like the MedRec module, we don't use it at the clinic because it was making the provider's note very messy. I know the PD clinic use it, but we've decided to not use it. So I use the BPMH module at the clinic to do the medication history. But basically I put basically on the PharmaNet on the left side, but everything that I import is manually. And then what is a bit of a shame is that if you do a really good job and you've all cleaned up, but somebody after comes back and just import everything from the Pharmanet, then all the work that you've done is kind of like it's
Oh, okay.
so yeah, so I mean it's as good as it gets when you get there, and I think that with time, like you'll just find a happy middle. So don't be too discouraged about what is going to be happening. The other there was one more thing I wanted to mention. Oh yeah, so they do a really good job about flagging the medication that are on the that are not on the BPMH and that are not appearing on the document medication by history, but are on Pharmanet. Like there is a little star happening to flag these medicine that they are likely new medicine being added. However, on the other hand, there is no flag for medication that are on the document medication by history, but have not been filled on the Pharmanet for the next, for the last 12 or 24 months. And so a lot of the time medication will be added, but medication that has been stopped, like it's a little bit less intuitive to stop them because they're not flagged.
Right. Okay. Thanks,
So, yeah.
Judith.
Okay. Thank you for that conversation. Now I'm going to quickly go back into the system and show MedRec. Okay, so I've logged back into the system. I've logged in as a provider, but the provider and pharmacists both will see this button of reconciliation on that order section. So if you select this black arrow in here, it's gonna ask you to do a reconciliation for admission, transfer, or outpatient. So for the purpose, for the patients that are coming in for KCC, we would always do outpatient MedRec, but for the purpose of this demo, I'm gonna do admission MedRec. So just suppose that we selected outpatient, and it's gonna be the same screen that would appear. So here you can see that there are various medications listed that have not been reconciled yet. So it's going to give you this, you can hover over and see the various orders from previous visit, and this button would tell you that this order has not been reconciled. And this is the other icon which would tell you the type of medication was inpatient. It's gonna give you the status of, it's also gonna give you the status of the medication, and these two icons in here, this green represents that you would want to continue the medication, and this red represents that you do not want to continue. So let's say I want to continue. Oops. It's not letting me. So for the purpose of this, if you say continue, if you select this green button, it's going to move the medication in here on the right hand corner. And if you say discontinue, it's gonna not move the medication to the right hand corner. So if you select green, everything is gonna move in there. And if you select red, these meds will not move in on the right corner. And after you've done your BPMA, after you've done your MedRec, there's a button on the bottom right corner which says reconcile and sign. So you'll hit the sign button, and it's gonna complete your medication reconciliation. There's another thing to note is that once you've done your reconciliation, it's gonna select it's gonna give a green check mark on your reconciliation status, which would show that your reconciliation is complete.
And just to specify, like if you do the document by medication history, you can get that green check as well. So that's not the only way to get the green check.
Yes.
Sorry, I might have missed this. For when you're doing that MedRec and those orders are showing up, where are those orders coming from for those medications?
So So these orders, so before, after the BPMH has been done, so all those medications that have been ordered for the patient would also show up under this orders under this medication section for the pharmacist and the providers to reconcile.
Oh, so it's pulled from the BPMH window?
Yes, so
Okay.
we do advise to have BPMH done prior to reconciliation, but I would let Vinny confirm this for me.
Hi, yeah, this is Winnie from Med Management. That's correct. If you do BPMH through the document history window that we demonstrated earlier, then those medications would appear here in the MedRec window. Also, any medications that were ordered, for example, in the merge, would also show up here if a patient was being admitted and an admission MedRec was being done. So the provider can choose to continue the medications in the merge, or they can choose to stop it.
Okay, thank you.
Thanks, Vinny. Okay. I'm gonna go back to my PowerPoint again. So I know we discussed this in the previous session. We do have this follow-up order for the kidney care clinic. I just wanted to bring it up in front of the group again that we did add Stone Clinic into this. The snippet doesn't say that, but we did add Stone Clinic to the appointments requested. And I know we discussed that currently St. Paul's is not using it, but I just wanted to ask the VGH providers that do you see yourself using the follow-up order?
So can you just recap that again? I guess, yeah.
It's better if I show you in the system. Sorry, just a second.
Okay.
So I've in the system, there's a follow-up order for kidney. So if a patient has come in and the patient wants to come back again for a follow-up, so we do have this follow-up clinic kidney care order in the system. So if you place this order, it's going to route to your kidney care queue for the clerks to schedule it. So the reason is that the patient is coming for a follow-up visit. You can put in the scheduling priority. There's a bunch of appointments, so that you can request the follow-up for. So there's GN follow-up, KCC follow-up, education group, individual education. So based on what appointment you select and you sign the order, it's gonna route to the clerk's queue to book the follow-up for that patient. So this is the intent of this follow-up kidney care order.
Yeah. Okay. I mean, I think it would be good to hear from Monica on this, but I see that it won't work well because we have to have our own MOAs okay the date, number one, and number two, we have our providers who decide whether they're seeing the patient next time as well. And from what I recall, each provider can't. No, what I mean by provider is, I know you mean doctor, but I also mean dietitian, pharmacist, social worker, etc. So they all flag themselves for the subsequent visit. And from what I remember, that's not really doable. And if that's true, then I wouldn't see this working well for most things. But it'd be good to get Monica's comments.
Yeah, no, I agree with you. We found that it wasn't required, even if you're booking and the KCC clerk is the one booking, just because our verbal communication was much more fruitful. And this actually would require an additional step for each doctor to then book a follow-up appointment for each patient. And it just made no sense. So although in theory it sounds okay, that the clinics where this has been useful is, say you have a multi-specialty clinic with everyone in their own room, like orthopedic surgeons and general surgeons, and they don't really talk to the clerks. So they're just sitting in their office way far away, and they're using this to kind of verbally communicate with their clerks. That's the places at St. Paul's, like the types of clinics where it's been helpful. In the kidney clinic, we've never missed it. It's a step not needed. The clerks can book without this order. And so it hasn't been useful for us.
Hi, it's Lori Clerical. I was just wondering I think Annie's on the line. Would this be helpful for just simple things like KRTs or transplant workups? Is there a free text area?
It just requires the doctor to start to place all of these different orders, which just didn't seem like it's there if people wanted to use it, but it was just an added step that didn't seem to be that helpful. But Annie, you know much better from your program.
Is Annie here? This follow-up thing is mainly for doctors only, or for other care providers like nurses and social worker?
So other clinicians can place this follow-up order.
Okay, so I'm not sure will be quite helpful for the nurses to, for example, if the doctors tell, okay, this patient needs education, can we use that to to communicate with our UC to book the KRT? Or like fistula follow-up or something like that?
So you can add what the intent of this follow-up in the special instructions is, but the KRT specifically is not in the appointment types, but we can add it if you are booking a lot of follow-ups for KRT.
It's Flo. So any of the clinicians can select one of those drop-down options in the appointment requested. So if it's in a KRT, you can choose education individual and then put in the special instructions KRT, for example. Or if it's like you can choose KCC follow-up, and then in the instructions you can put for, fistula assessment or whatever. So yeah, those options are there. And then once those are selected, then that's when the clerks will get a list of them in their queue, and they can book accordingly. So you don't need to have that verbal communication.
Yeah, we have been using like paper to communicate, for example, book transplant workup, fistula follow-up, to book the KRT session. So if this can be used, I think that would be quite useful.
Yeah, I could see that this just being used for those things as well.
Is there a way to, sorry, it's Lori Clerical. So if we book it, is there a way does it bounce back and notify the person who submitted it? Or is it just kind of like they have to look and see if it's done?
So it's not going to necessarily send a notification to the person who booked it, but it will route this order to the clerk's queue for them to book it. So when they're going into scheduling, when they're going into the request queue for kidney clinic, they'll see this order there so that it gives them a queue to book the follow-up.
But the person that ordered it would not know if it was done by the clerks, right?
No, unless they check the appointments tab, like on the menu, to see that they have an upcoming appointment. Or you can verbally say, oh, I did it.
Okay, thanks.
Okay, so what I'm hearing is there are scenarios where the unit would like to use this follow-up order.
It sounds to me that if it's for those clinician follow-ups that aren't attached to a provider appointment, then it could be useful, and that will be a better way to keep track rather than writing it on paper. Whereas the process for the appointments attached to a provider, then that's where this may not be useful.
Okay. Thanks, Phil. So we do have this in the system, so this order is always available for the clinicians to place.
Can I just ask the group if there are any appointment types that may need to be added to that drop-down window? I know we added the Stone Clinic follow-up, but just kind of given the conversations that we've had, there's a lot of specific education type of appointments. Just let us know if there's any additional appointment types that we can look into adding.
I mean, in a way it's there because you could say, you could just click education individual and then specify that it's KRT, for
Mhm.
example,
Yes, correct.
or education group, and then specify under special instructions that it should be choices class.
Mhm.
But I guess, you know, Annie, do you think from the nurse's point of view, that would be, is that okay?
Yeah, I think so. Someone raised the questions about like Stone Clinic, yeah, you mentioned about, and also we do have some patients just RD only, and this can be used also.
Yeah, either do you want one that is appointment requested RD only, or do you want to just use the KCC follow-up and then in special instruction put RD only?
I guess so we can use KCC follow and then specify that RD
Yeah.
only. Yeah.
Because the only one I think that needs to be added is the Stone follow-up.
Yes.
And then for transplant education, that can be
KCC
education
follow.
individual.
Yeah. Okay.
Thank you.
Sounds good.
That's
Yeah.
perfect.
I just guess from our learnings, the biggest thing is the consistency and follow-up and use. So really it's only coming in from one method. So the way we went from paper to electronic for things like that is we decided to use the message center function and message the clerk and say, do this, do that, just because the diligence of ensuring that you went in and placed an order just wasn't there. And so when we started, we had some orders coming in from this way and some coming in from that way. And so whatever's decided just has to be the same way. And we found that we couldn't diligently order these order types. So that was our learning, but it might work better for others.
Yeah, I could see that because you get used to using the messages for other things, I would imagine.
Exactly. And there's a message chain. So the clerk, to whoever asked that great question before, the clerk says, I've booked it Tuesday at 4, and you say, thank you. And then that's kind of done. And initially we were under the impression that this was a necessary step along the ordering, but it really just is a tool for us. So, and then we were asked, oh, please place that order. And then we were like, no, I did. I told you to do it. And so that's kind of was our learnings with it. So just the kind of caveat before getting too granular about the different drop downs that you can do. Yeah, I think that's what we found.
And these follow-up orders are attached to the patient, right? So if it was education group, would we have to use, like, go to each patient and click an education group?
Yes.
Okay.
Okay. So I'll quickly go back to my PowerPoint again. Okay, so that's all I had for the providers, but please feel free to stay on for the rest of the session.
I do want to just mention that there are order set sessions planned later in this month of April and in May. So we could talk more about the specific power plans used in the KCC in those sessions.
Okay, that's great. And so can you remind me for the rest of today, what is the plan for the rest of today's session?
So the main agenda for today was BPMH and MedRec, but for the rest of the session, I'm just going to give a refresher of what we discussed in the previous sessions for the nurses and for the allied health.
Okay, great.
Thanks. Okay, so just going to quickly talk about ambulatory organizer. As we discussed in the previous session, ambulatory organizer is just a consolidated way to view all the appointments that are scheduled for that day for that unit. So I'm going to quickly go back in again and just show how it looks like in the system. So you have this ambulatory organizer in the top menu section in Cerner. So if you click this ambulatory organizer, there are, so if this screen is blank, that means there are no patients scheduled for renal dialysis and all the resource groups that are mentioned in here. So patients, so this functionality here gives you an opportunity to see patients in a consolidated way for all the resource groups that have been selected. So you can always go in and modify and add in units that you want to see or remove units. So for VGH, for kidney care, we would say kidney care clinic in here. It's not built in the system. Oh, it's there. So you can select individual resources, or you can select all resources for VGH. So there are resources based on the nurses, pharmacists. So if you just want to see patients for the pharmacist, you can check in this box and the patients would appear for that day. The patient consolidated patient list would appear. Okay. So this is the calendar. It does give me an opportunity to see patients in the past and in the future. So if I go back and let's say I do want to go to January 14th. Oops, no patient in here. So for January 16th, there was one patient for these resource groups selected. So it's going to give you the list of those patients. So what appears is this information does get pulled from the scheduling app. So while the clerk was scheduling, he did add all this information in the chat book. So it's pulling in that information from chat book into the ambulatory organizer. So this is the time that the patient is coming in. This is the room that has been selected or assigned to that patient. This is the duration of their treatment, the patient's name, age, gender, the details of the appointment, and this is the status of the appointment. So for example, the patient, this confirmed status means that the appointment has been scheduled and confirmed. But when the patient comes in, if you select this drop down, it will give you different options to choose from. So if a patient is in, you can either say check in, and usually for virtual appointments, we say arrived. Okay, but if the patient did not show up, you can always say no show. If the patient canceled their appointment, you can always select cancel. So based on the status of the appointment, you can select these various options. Okay. There is this little note icon in here. So for example, if a patient is in here and it's waiting in the waiting room, you can add a note in here and it will appear on the ambulatory organizer. Okay. Any questions on ambulatory organizer? No? Okay.
Sorry, it's Lori Clerical. Are we using this at KCC is what you're saying?
Yeah, so the ambulatory organizer is available to every profession. So if the nurses are checking in the patient, they can use ambulatory organizer, or you can always check in the patient from chat book as well. So it's just another way to check in a patient.
Okay, so is this just a way to check people in, or I guess we have to find out if we're using
for
this or
you.
not?
Yeah, it's for you guys to see who all the patients are booked for that day coming in.
Okay.
Like, how do you guys see the appointments booked right now? Is it like a printed report, or you write it on the whiteboard?
To see all the patient appointments, it's pretty much taken off the PCS list and then written on the whiteboard.
Yeah, so this should replace your whiteboard.
I don't know about that part, because is it just to say that the patients arrived? Because on the whiteboard it shows which providers, and sometimes they move providers around to see different patients. So how would that work? Just wondering.
Just to let you know, at St. Paul's, it has like the whiteboard is still there.
Okay.
So ambulatory organizer is just like a consolidated view to see your patients that are coming in for that day. So for that day, if a patient is just coming in to see the nurse or the RD or the social worker, if you select that resource from that top patient resource icon, it's gonna give you patients for all those resources for that day.
Okay.
It's Deborah from St. Paul's. Can I just add to that? So the ambulatory organizer is kind of like the schedule, so you can look ahead to see what patients are scheduled in the future. We do still have a whiteboard for day to day, like the clinic schedule, like on that day, which we hope to maybe use a track and shell, like a Cerner track and shell in the future.
Okay. Thanks for your inputs. So the next piece is the COVID screening form. So I just wanted to ask who currently is doing the COVID screening in your unit? Is it the clerks or the nurses?
Both.
Is it the nurses?
So if it's the patient's first appointment at the kidney clinic, then it's the clerk that's been doing it. But if it's a follow-up appointment, then it's the first person who's scheduled to see them.
Unless it's the doctor seeing the patient first, then it's the clerk.
I see. So we do have this patient COVID screening form in Cerner now, which can be accessed by clerks and the nurses and other professions. So this COVID screening form can be used to do COVID screening, and clerks can access and document on it as well. So I did have some content for the allied health. Just wanted to know, I know social worker is not on the line, but are any dietitians there?
I don't think so. There's any dietitian from the clinic today.
Oh, okay.
Lynn said she was joining a little bit later.
Okay, so that's okay. We can always demo this in the next session if there's no allied health in there. I did have pieces, so this was the last segment. I did have pieces for dietitian and the social worker. So the last slide that I have for today is this additional form that we wanted to review. So I just wanted to ask, is your unit still using this form?
Yes.
Okay, and how are you guys using this? When would you use this form? When the
That
patient?
looks like the one for the stone. We when that's a new stone patient. Clip that form onto the front of the chart, and then when the doctor would see the patient, they would fill that out, and then we'd enter that into Promise.
I see. So just for patients coming in for their stone clinic appointment, or for other clinics as well, or just the stone clinic?
For Claire, yeah, it would be just the stone, because the other appointments or the other ones are already that core, or that part of that core form is already attached to referrals. So just
okay. All right. So yeah, that's all we had for today. Any questions based on what we demoed and discussed? No? Okay. So the next steps would be, we do have a follow-up session 3 on May 2nd, and we would validate the future workflows on that session, and we would show some demos for allied health, since they were not able to make it on this call.
Very Puneet, Lynn actually just joined.
Sorry?
Lynn actually just joined. She's the dietitian for this clinic.
Oh, perfect. So, hey, Lynn, I did have some content for the dietitians today. So I'm gonna quickly deep dive into the system and show you some demo for the dietitian. Just a second. Oops. Sorry, let me log in as a dietitian. Sorry, give me one moment. There it is. Sorry about that. So I am logged in as a dietitian. So the first thing that I would go is, and I would see my multi-patient task list. So these are all the patients that are there on my list for myself to see. And this gives me a consolidated list of my patients, and it's gonna give me the status of is it pending, is it overdue, and just a comprehensive view of the patient's visit details. Okay, so I'll quickly log into a patient. So I've logged in as a dietitian. So the same thing, this is the top banner bar for the patient. It's gonna give me everything from registration. It's gonna give me process disease isolation alerts, the location. Okay. We do have a separate band for nutrition care where the dietitians do document. And so this nutrition care band has separate sections for them to document. You can see it's pretty extensive. So all documentation can be done here from a dietitian perspective. And we do have ad hoc power forms as well for the dietitian. So in the ad hoc folder, there's a separate section for nutrition services, which would list down all the power forms that a dietitian can document on. So for example, if we select advanced care planning and say chart, it's gonna give me, it's gonna open this advanced care chart for power form, and we can document, the dietitian can document on this power form. Okay. Strange. Where did the M pages go? Oops, here. So we do have an M page for the dietitians. So if you go to the Allied Health M page, it's gonna give you a consolidated view of the patient's chart. And you can see the advanced care planning and goals of care. You can see the history for that patient. You can see team communication. So this is a tool where you can communicate with your team. So if a dietitian enters in a note for this patient, it's going to remain on the patient's chart. And if another clinician comes in, they can see this. They can see the note placed by the dietitian. Okay. There is a notes, or there is auto text that have been created specifically for the dietitian. So if you say dietitian note and you say okay, it's going to give you this free text to document a note on. And if you say comma, oops, sorry. So there are auto texts that have been created just for the dietitian. So this is the first one. If you select this note, it's gonna pull in information from the patient's chart so that you don't have to manually go in and write a clinic note every time you see a patient. So this particular auto text is built for dietitian clinic notes. Okay. Any questions from dietitians?
No, it's pretty clear.
Okay, thank you. Yep, so I'm gonna stop sharing. So that's all we had for today. The agenda was pretty small for today, but for the next meeting, we would validate the workflows that we would create for this unit. And that meeting, I think, is scheduled for May 2nd. But if no one has any questions for now, I'll give everybody back their hour and 20 minutes.
Hey, Puneet, it's Flo. Sorry.
Hey.
Just one thing, I know in this clinic, the nurses do track and keep track of patients who get immunizations outside of the clinic. Are you able to just show that section, like the immunization section, and how to document immunization history and things like that?
Yeah, sure. Let me share. Can everybody see my screen again?
Yep.
Okay. So I am logged in as a nurse in here, and that sections that Flo was talking about, you can see it on the left corner of the screen under the table of contents. So you would see there's a section for allergies in here where the nurses or other clinicians can document allergies. So if you say add from here, it's gonna give you this screen where you can document allergies. So let's say we have an allergy, or this is also the binoculars. You can just search and it's gonna give you, it's gonna give you the various types of substances that are in the system. So for food, I'm gonna say food preservatives. I'm gonna say okay. So you can add the severity of the allergy. You can add in the category, and once you add in all the fields that are mandatory, and with mandatory I mean all the fields that are in yellow, that's highlighted in yellow, those are mandatory fields. So you can select the category from here as well. So if it's drug, food, environment, or if there's some other category, you can always say other from here. And once you say okay, it's going to document the allergy for you. So for example, if you want to document other allergies, multiple allergies at the same time, you can say okay and add new. This will let you, this will give you that window again, so you can document multiple allergies at the same time. Okay, let's say pollen. Okay, so we want to document pollen allergy and say okay. So so this category is highlighted in yellow, so that means you do have to document it. So pollen, I would say, is environmental, so you say okay. So then it's going to give you, so there's food preservatives, there's pollen, so it's going to give you a consolidated view of allergies. Okay. We do have another section for immunizations in here. So this section would give you an opportunity to document immunizations. So this is how this section looks like. So if you go to history, it's gonna give you a, if you go to add to selections, it's gonna give you a list of all the vaccines that are present in the system. So if you want to document a vaccine from here, you can select that. So for this example, let me say COVID-19 and you say add, and then it's going to give you another window to document all these fields. And this is highlighted in yellow, so this is a mandatory field. So source of historical information, let's say a family member. Okay. And it's gonna, so for once you document all this information, it's gonna enable this chart button. So once you click on this button, it's gonna give you it's gonna let you add COVID-19 mRNA vaccine into the patient's chart. Okay. Anything else, Flo, that you want me to demo?
Yeah, can you also click on the appointments menu? I think this will be handy for Bikini Clinic too. Basically, if patients have other appointments elsewhere, like in transplant clinic or where some other clinic that you're wondering whether or not they have appointments booked, you can actually look up all the patient's appointments if they're booked in Cerner from here. And there's filters across the top that you can select and look ahead or look at past appointments and things like that.
Yep.
Sorry, quick question, clerical. Is like radiology using this?
I believe so. I think they're in scope to be using that. I'm not sure actually.
Yeah, I can go in and get that information for you, Lori. I can double check if cardiology is using it.
Yeah,
Sorry.
because is Annie here because like some of the pre-transplant workup is required the our clerk to book like echocardiogram or maybe through the cardiologist department.
Hey, it's Stephanie from the ambulatory team. I can actually speak to this. Radiology appointments do show up in this section. So if you had an echo book for your patient, it would show up in this section, or a MIBI or any of that pre-transplant workup stuff will show up along with all other appointments.
That'd be handy for nurse.
Yeah, but like how our UC can, because we use the paper form, they usually fax the paper form down to cardiologist the apartment in order to book the appointment.
Yeah, so then once it's booked in the system, then it should show up as long as they have an appointment in Cerner.
Okay.
So the process is the same. Lori would still fax the form and then, or however the order is placed in Cerner in the future. And then on that side, the cardiology clerks will receive that order and then they'll schedule the appointment and then it'll show up on this list.
Okay, sounds good.
Yeah, because now nuclear med, you can phone and book directly with them, but with Echo, you have to just fax it and then that's pretty much it. You don't talk to anyone anymore.
Yeah, so this would be a good way to see whether or not it was actually booked, because then you'll see an appointment there or not.
Yeah, exactly. Thank you.
Oh, one more questions about that. Like for the pre-transplant workup, the chest X-ray and ECG for our patient is just like we just give the form to them. They just go to the walk. They don't need to book appointment. They just go and walk in, and then if they done, is it do they put it in here as our appointment on that day too?
I think if it's for walk-in, it's probably not scheduled, but you'll just get results.
Okay.
Does that make sense?
Yep.
Okay. Let's stop sharing. Anything else that anybody wants me to demo? Like allied, nursing, I know providers are not here anymore, pharmacy. No? Okay. Well, thank you everyone for joining the session today. And our next session it's on May 2nd, and we would validate the workflows with you on that session. And I would add this allied workflows and allied demo in that session as well. Okay, I would give you your 1 hour and 10 minutes back. Thank you so much for joining. Bye.
Thank you.